10 minutes to your health.
So, folks, with the dry season that we're experiencing, we have invited consultant rhinologist Dr. Warren Mullings to walk us through what allergic rhinitis is and how to treat it. Welcome, Dr. Mullings.
Morning, morning. Thank you for having me.
Oh, it's our pleasure. First, tell me who's a consultant rhinologist?
Well, as somebody who, after studying ENT, ear, nose, and throat surgery, has gone on to specialize in diseases that affect the nose and the sinuses and the skull base, really. So
Yeah.
it's somebody who specializes in the nose and sinuses.
Yeah, I was telling my colleagues here that for some reason something came over me just now because I react to scents and
Yes.
it throws me off. Is that an allergic reaction?
Oftentimes, it may not be allergic. It may be what we call non-allergic rhinitis. In other words, you're not allergic to it, but you're sensitive to it. But it may be allergic, and sometimes we have to do tests to figure it out.
And leads me to my next question. How do I know first if I'm allergic? And then second, what I'm allergic to?
That's a great question, actually. So oftentimes we look for symptoms. So if you have a lot of sneezing, itching, itchy eyes, itchy nose, you may have swelling. Those are some of the hallmarks of an allergy. However, other things may present in that way. So the definitive way to figure it out is really to do what we call allergy testing, where we introduce small amounts of the allergen or the thing that you may be allergic to in your skin, for example, to see if you develop a certain amount of reaction to it. And that becomes a definitive test. Oftentimes we can do blood tests as well if it's available.
Okay. But how would I know in the first place what happens to me? Do I start to sneeze, sweat? What happens to me when something happens?
Right. So oftentimes your body tells you right away. So you know your nose may itch, you may start to sneeze, your eyes may start to run, you feel unwell. Sometimes you may cough. You find that if you remove yourself from the situation, you feel better. You know, your eyes may tear. A lot of the things that you have on your screen, um, including a rash.
Yeah. So I'm allergic to orange juice. I just stop drink it, or can you do something for me that makes me not allergic to it after a while?
Well, food allergies are a lot harder to treat, to be honest, rather than environmental allergies. Oftentimes, we employ what we call avoidance therapy. So, really and truly, the primary way is to avoid the allergen that you may be exposed to, and making sure that you know the ingredients of your food so that you can prevent exposure.
What was the other kind of allergic you said? Food, and what was the other one?
Environmental. So many
So,
times there's pollen in the air, there may be dust, there may be dust mite. A lot of those things we can actually test for
yeah.
and treat doing what we call immunotherapy.
Yeah.
So oftentimes we start off with simple over-the-counter medications. You may get prescribed medications such as nasal sprays or antihistamines. And often if those don't work well or your reactions are severe, then we move on to something called immunotherapy, where we work with an allergist, and you may get small amounts of the allergen, either underneath your tongue or as an injection for some time. And then we develop what we call tolerance, so you don't react to it as much. And oftentimes that's quite successful.
Yeah, which was going to be my question. Before we get to what's going on now, because it's really bad now
Yeah,
with the dust.
absolutely.
But the environment is always going to be there. So if
Absolutely.
I'm allergic to the environment, I need to be treated because I can't just say, well, I'm not going to go outside anymore.
Absolutely. And so therefore that's why testing is so important. It's important to identify what in your environment you may be allergic to, and to isolate that, and then to treat that specifically. And that's why allergy testing is so crucial.
Yep. How dangerous can this be, Doc? I'm a football coach. I don't know if you know that, but I remember dealing with a youngster who, and in a serious way, he was jogging one day and he just started to swell up.
Yes,
I was told afterwards that it was an allergic reaction, and I was also told that we could have lost him had we not reacted quickly. So how dangerous can this be?
well, as you've mentioned, it can be so severe that you have swelling in what we call your upper airways, your mouth, your tongue, your voice box, and your wind passage, and you could essentially stop breathing, and unfortunately you may die. So, food allergens especially important too. So oftentimes there are people who have peanut allergies.
Yeah.
And if they're not aware or they're exposed inadvertently, they may have a significant
Yeah.
and unfortunate outcome. So it's exceedingly important to
Yeah.
know and treat.
Forgive my ignorance, Doc, but can you stop yourself from being allergic to something? In other words, before I react to something, is there any drug that you can say, well, if you take this, you're not going to be allergic? Can that happen?
Well, that is a great question, actually, because what we have found is that oftentimes we avoid certain foods in early childhood, and we create what we call sterile environments for children. And then what happens is that they are not given the opportunity to learn how to deal with these antigens or these allergies when they're very young. And unfortunately, when they get older, what happens is that they can't mount an appropriate reaction to the allergen. So what we try to do is that we ensure. Excuse me, my daughter just came
No,
by
man,
to
that's
say
fine.
hello.
That's fine. I wouldn't mind seeing her. That's fine. Hello. Yeah.
So basically what happens is that we encourage people to start introducing foods at an earlier age and taking children out in the environment. It's not as sterile. Have them run up and down
Yeah.
a lot. And oftentimes what happens is that they don't develop, they're not as, atopic or allergenic, or they're not as, reactive to their environment.
Yeah.
So there's a lot of work going on with that. And actually,
It's something you develop, or you're born with this, or what?
so we think that it's something that it's an immunological response. And so what happens is that everybody has an immune system and they respond to it. But the response may be inappropriately aggressive to an allergen that everybody's exposed to. So what we find is that if growing up, you're exposed to them at smaller doses at a younger age, then your reaction tends not to be overwhelming. There are people who are born with a hereditary predisposition to severe allergic reactions. Those we have to treat differently. But for the majority of the times, we find that if we're exposing our children to a less sterile environment, then they don't develop as significant allergies or even severe asthma.
Talk to me about what's happening now with this Sahara dust. Boy, even this morning I came out, you could see the smog, for want of a better word.
Absolutely.
So
Absolutely.
what do we do? And I suspect even if you're not allergic, you have to be careful with this dust.
Yeah. So, as I was saying, there's allergic and non-allergic rhinitis. So even in fact, if you're not allergic, the fact that the dust is there is an irritant, and it may cause you to sneeze, have a lot of dry throat, itchy eyes, itchy skin, a rash, may cause you to have a cough, have difficulty breathing, and certainly if you're predisposed to severe reactions, so if you're asthmatic, for example, that could certainly get worse. So what happens with Sahara dust is that there's particulate matter, and they've done studies to figure out how much there is, and they find that the amount of particulate matter in the air increases by over 35%. So it's a significant increase. And as soon as you go outside and breathe, you'll realize that something is off. It's very hot and arid and dry.
Yeah.
And then you have this particulate matter that irritates your throat, nose, and your lungs.
Does a mask help?
Absolutely. So, as with anything else, avoidance therapy is really good. So that, reducing your exposure is really good. So we start by staying indoors as much as possible, if you can. Using air purifiers inside the home if you can. Wearing a mask, even wearing eye protection is good. Wearing longer sleeve clothing is good.
Yeah.
Just to reduce your exposure. And then oftentimes, if you can't reduce your exposure, you can reduce your reaction by simple things like saltwater rinses to your nose, or saline nasal sprays, or gargling your throat with, warm salt water.
Yeah.
And your eyes as well can be quite helpful to remove the irritant, to remove the dust,
Yeah.
and prevent its reaction.
Final question. You said if you cover your eyes, you mean outside of just a pair of glasses, you mean?
Right. So there are certain protective eyewear, for example, even with Corona, we've used them a lot more in the hospital, in a medical setting, but certain eyewear that can cover even to the sides can help. Oftentimes you see people who work in the different industries like welding and so on. Some of them are really big and obnoxious, but some are quite small and sleek.
Yeah.
If you find that you have severe ocular, well, eye symptoms, allergies, then you can wear those if you must go outside to reduce your exposure.
All right. Sir, you are one of the frontline workers. I salute
Absolutely.
you, sir. I applaud you. And I
Thank
pray
you.
that you will be safe. What's your daughter's name?
Her name is Arabella.
Arabella. Well, I like the bell part of the name, Arabella. Say hi for me and thank you, sir. And again, we applaud you and God go with you. All right?
Thank you. I work with a great team, so
Fantastic. Dr. Warren Mullings, consultant rhinologist. 10 minutes to your health. We'll do it again next Thursday.
10 minutes to your health